Greetings. It's a new year. It's 2020. And I just want to wish all of you a happy and prosperous new year. Last year, we enjoyed a number of topics that we shared, and I'm hoping that we would have learned from what we discussed. But this year I want to start out with a very important topic at this time, and it's the issue of flu. Because we know that flu is now having a significant impact on health throughout, especially the Western world and the Northern Hemisphere, which include parts of the Caribbean. And so, what causes the flu? The flu is caused by a virus. Generally, it is caused by the influenza virus, so it's not a bacteria. So, what are the risk factors for getting the flu? Most importantly, being exposed or being around someone who has the flu. But those who are categorized as high risk are those who are elderly, children below 5 years of age, especially below 2 years of age, those who have underlying health conditions such as diabetes, asthma, heart disease, or other respiratory diseases, or immunocompromised in other ways, maybe through HIV or treating neoplasias or cancers, are at extremely high risk. But anybody can, of course, catch the flu if he or she is exposed to the virus. What are the common symptoms of the flu? And I want here to separate what is a cold from the flu. The common cold, which is also caused by a virus. Normally you might have some snuffles or some runny nose, but generally you feel well. Even you might have a mild cough. But with the flu, it can come on suddenly, and the symptoms tend to be more severe. Apart from the runny nose and snuffiness, you can have headaches, eye pain, body pain, joint pain. You can have high fever. And not everybody gets a fever, but that can definitely be part of it. So the difference is the flu has more systemic symptoms, and the symptoms are much more severe than the common cold. Now, what are some of the complications of the flu? One can have pneumonia. Pneumonia is an infection in the lung, and this is one of the most common complications. But the flu does not only affect your respiratory system, like your throat and nose and lung, but it can affect other parts, like the brain, and cause encephalitis. It can affect the heart and cause infection of the heart. It can affect your GI tract as part of the symptomology. So the flu can have these devastating types of complications, and that is why we should not take the flu lightly. So how can you prevent the flu? You can prevent it by making sure that you wash your hands frequently, that you avoid being around persons who have the flu, that you make sure that your general health is in good stead by making sure you're eating properly, you're drinking sufficient water. I'll tell people, cut the smoking, the excessive alcohol, and make sure you manage your underlying disease as well. Keep your asthma in check, keep your diabetes in check, your heart disease, and so forth. And so keeping yourself generally healthy, avoiding persons who have the flu, frequent hand washings, and so forth can help you to prevent the flu. But once you get the flu, what do you do? The number one thing, I think people should self-quarantine. It means to separate yourself from others so that you don't spread it, and that you also make sure that you don't sneeze around, you have tried to avoid putting your hands around, and because you can put the virus on surfaces and people can pick up the virus and introduce it into their bodies and so forth. And so you want to self-quarantine. Make sure you drink enough fluids and stay hydrated. And if you have any underlying condition, you try to keep those as much as possible in check. If you have fever, you can take Tylenol or paracetamol. I would not recommend the NSAIDs such as the Voltaren and Motrin and so forth. And if you have snuffing, you can take a decongestion. And if you have pain, the paracetamol can also be used for the pain. And rest and give your body a chance to recover from the flu. Now, there are discussions as to whether vitamin C helps. Sometimes, some studies have shown that it helps those in the extreme of ages, the children and the elderly, but it is not clear. But once you have tried all of that, there's actually medication for the flu, and that medication is called Tamiflu. And there are others, but this is the one that is highly recommended. It's quite expensive here in St. Kitts and Nevis, but I have indicated it or recommended it for many of my patients who I deem to be very high risk. But it is good to start that medication within the first 48 hours of having the first symptoms. But the other thing that can also be used is the vaccine. We do not have total access to the vaccine here. I know that those who are at risk can have access to it at our clinics, and I encourage our people to really get it. But the vaccine should normally be given sometime before the expected flu season starts, so that once it starts, your immune system would have already been revved up to deal with it. And with those, you can actually help to treat yourself and prevent the flu. Now, when should you see a doctor? If you notice that the symptoms are becoming severe, you have shortness of breath, extreme symptoms, lethargy meaning you're feeling weak, you can't move around as you used to, chest pain, shortness of breath, significant cough. You might have people who are talking out of their heads, as maybe affecting that aspect. People who seems to be having trouble with their heart and so forth. Any signs of serious symptoms or complications, I recommend that you seek health care by a health professional. That is important. And so I encourage you that if you do these basic things in terms of prevention, getting the vaccine if you can, seeing your healthcare provider, take care of your general health. Otherwise, I think you have a good chance of beating the flu in this flu season. So I want to thank you for joining me, Dr. Terence Chu, for another episode of Caring for You with Dr. Terence Chu.